Hello, welcome to Resilience Radio. I'm Irvin Eisenberg, host of the show and owner of Resilience Occupational Therapy. Today's episode is episode 54, and we will be discussing Medicare. I wanted to give a different disclaimer than usual, which is that I am not a counselor for Medicare, navigating the Medicare system. I really am a Medicare provider, and I've talked with and worked with a lot of different people who are on Medicare and have been navigating the system, and it just seemed like some clarity around it was in order, and I could be wrong on any of this. I suggest you reach out to a Medicare counselor. The Council on Aging for Central Vermont has people that can help you with that to really determine what policies are the best for you. But in any case, I wanted to break down the different parts of Medicare and a little bit of perspective that I might have on it. First off, Medicare, which under most circumstances starts at age 65. There are circumstances where if you're continuing to work, you can stay on your employee's insurance longer than that. And there are circumstances with certain types of disability where you might start Medicare early. But in any case, Medicare Part A covers hospitalizations and short-term stays at rehab facilities. Probably a couple of other things covered in there that I'm not as familiar with because I'm not a Medicare A provider. Medicare Part B covers various things, but primarily outpatient visits. And for my purposes, anyone who comes into my office for outpatient services, which is what I offer here, is getting Medicare Part B if they're on Medicare and they're using the AB system. And Medicare Part B covers 80% of the visit. So I will then be billing the extra 20% either to a third party and an additional health insurance if you have one, or that will be what is owed by the clients. Additionally, Medicare Part B has a deductible. I believe it's somewhere around $250 that you would have to pay before that 80% kicks in. Medicare supplemental plans, which is not Medicare Part C, it is its own thing, are when a insurance company decides to cover what Medicare approves but doesn't necessarily fully pay for. So in the case of Medicare Part B, a Medicare supplementary plan would cover that additional 20%, and it might cover the deductible as well. Now, there are a variety of Medicare supplemental plans, and some people will get the full coverage where they're paying monthly into their Medicare supplemental plan, and they will have no deductible. They will have that completely covered in the Medicare deductible and the additional 20% on those Medicare Part B services. Now, having talked to a lot of people who have run the numbers for their own financial situation, the ones who seem to put the most thought into it, I found, tend to do a high deductible for this. So the people are saying, you know what, I'm fairly healthy. I'm not going to be using this a lot, but I really want to make sure that the amount of money that I'm paying into this is less, and if I end up having to use a lot of services, I can afford to, and I'm willing to pay a higher deductible for it. So when you're shopping Medicare supplemental plans, you might want to really dig into the numbers to figure out whether or not a high deductible plan might actually be the better coverage for you. So we've covered Medicare Part A, the hospitalizations, Medicare Part B, and the supplemental plans that go with Medicare Part A and B. Now we're going to skip Medicare Part C for the moment, and move on to Medicare Part D, which again, I'm a Medicare Part B provider. I don't know that much about Medicare Part D. It is primarily for prescriptions, so prescription drugs. One thing I have heard that a lot of people who don't use their pay for a Medicare Part D plan is that if you don't pay for that, and then later on, as you age and might be needing more prescription drugs, you decide that you're going to then get Medicare Part D, that it costs more, that the premiums are higher than they otherwise would be. I don't know if you're fully paying all those back premiums or they're just making you pay a lot more because it's sort of how the insurance works, that if you're less likely to use it, then you can get the lower rate. So that covers Medicare Part D, which is purchased separately from Medicare Part A and B, which is included with insurance as you get to be 65. And that's separate from the Medicare supplemental plan, which helps with A and B. Let's step back to Medicare Part C, which I am really not a fan of. This is the Medicare Advantage plans. So Medicare Part C is not its own coverage. It is coverage that supersedes and kind of it's opting out of the government Medicare model and deciding to have a government-approved private healthcare model, which is these Medicare supplemental plans. Now, I am not a participating provider for any of the Medicare Medicare Advantage plans. And these Advantage plans, I think, should be called Medicare Disadvantage plans for the majority of people. They often are advertised as costing little to no money. Sometimes cost a significant amount of money depending on what's going on for you and what coverage you're getting. And will advertise that they cover all of Medicare Part A, B, dental, vision, and prescriptions. And on the face of it, that sounds great, particularly if it would be free, right? However, it's not the same as getting regular Medicare. Someone who is a participating provider, a doctor or an occupational therapist who is covered under Medicare, follows Medicare rules, might not decide that they are going to be a participating provider with a specific supplemental plan. So what that means is you have Medicare, which a vast majority of clinicians accept if you go with the federal program of Medicare. But if you take the Medicare Advantage plan, you might not have a doctor or a specialist in what you need. Now, there are rare circumstances where this might be beneficial to you. I'm a little bit skeptical and haven't seen the numbers on it. I have heard that for some folks who live right in Boston and have access to all the medical care they could possibly want, and they know that all their doctors that they might want to see are participating providers in a Medicare Advantage plan, then it might be useful for them. I still find that a little bit suspect. I wonder if the Medicare Advantage plans are dictating what type of services are going to be covered and whether or not you actually get as high quality of care from your physician if they're having to do it through Medicare Advantage plan versus a regular Med A or Med B plan. So I encourage to use a lot of caution if you are deciding to look into Medicare Advantage plans. When you're seeking advice on what type of Medicare plan to get, you might find yourself going to some seminar that's going to be talking about Medicare, and it might actually be put on by one of these private companies that's trying to sell you a selection of Medicare Advantage plans. So buyer beware on Medicare Advantage plans. Supplemental plans are usually worth doing, and you might want to look into the difference between high deductible and low deductible. Prescription drugs, if you're going to do it, it's probably a good idea to do it earlier on so that you're not paying as high premium later, but you want to look into those numbers on it. Beware of who you're taking advice from on what type of Medicare to get. And I will cover one more thing that I realized I did not talk about when we were discussing supplemental plans is if you are on Medicaid, you can have Medicaid as your Medicare supplemental plan. It is my understanding that Medicare always bills first. So if Medicare does not approve something, chances are that your supplemental plan will not approve it either. If Medicare approves it but doesn't pay for all of it, which is typically the case, then that's when the supplemental plan would kick in. And if you have Medicaid, it is my understanding that anything that Medicare approves, even if it doesn't cover it, Medicaid will pick up the rest of the bill on that. So that is my brief understanding of what Medicare plans are available and what you should consider when shopping the very complicated market of Medicare. If you enjoyed this episode, or if you think I got something completely wrong, please feel free to reach out to me. I am happy to add in the show notes any corrections. And if anyone thinks that I'm completely off base in any of my assumptions here, I am more than happy to do another show at some point to showcase those other opinions. Along with that, I would like to challenge people that if anyone can come up with a good argument why a Medicare Advantage plan isn't just ripping you off and selling you a bill of services that's just not as good as you as advertised, and then please give me your circumstances as to why your Medicare Advantage plan is helping you, or a circumstance in which it might help someone. Thank you for listening. If you have any feedback, as I've already said, feel free to reach out. Irvin, IRVIN.Eisenberg, EISENBERG @gmail.com, and I will certainly get back to you. Thank you for listening to Resilience Radio. The show music is brought to you by Aaron Marcus with their tune, Some Biological Process. I hope you enjoyed listening. Take care.